Hi class, so this week we're covering chapter 15, single case design evaluation. So this is a chapter that you need to pay attention to because this is the chapter that you're doing that single system design over. And so please make sure you listen to the lecture, make sure you read the chapter, and this is where you'll get all the information you need for that single subjects design paper. So single case design evaluation is also called single system design or single subject design. So sometimes you'll hear single case, single subject, single systems. They all mean the same thing. Okay, so they're all referring to the same thing. So single case design is used to evaluate the effectiveness of an intervention or the effects of a policy of an individual client, family unit, or individual case, which could be an individual community or an individual group. So the time series design is where there's repeated measurement or observation of your dependent variable before and after the intervention, which is also considered the independent variable. And so basically, the time series design is a repeated measurement or a repeated observation of your dependent variable before you actually give the intervention, which is your independent variable. Single case design evaluation is used to determine the effectiveness of social work practice and allows engaging in practice-informed research and research-informed practice. It allows for answering 3 research questions. What intervention is effective? For whom is it effective? And under what conditions is it effective? So your target behavior is behavior that you and the client agree to work on during treatment. This is also your dependent variable. So in your single subject design paper, your target behavior is the behavior that you or your classmate, your partner, will work on during the treatment. So you want to operationalize your target behavior in a positive manner whenever that's possible. This occurs during the assessment phase. The target behavior must be amenable to being measured repeatedly. It should also be one that can be measured at the same time and in the same place every day so that changes can be attributed to the intervention and not to outside factors. So as you're working with your partner, they need to make sure that they're observing their target behavior, measuring it repeatedly, measuring it the same way, the same time, the same place every day so that they make sure that no outside factors is contributing to the changes. If the client identifies several behaviors, ask them to prioritize which one to work on. So if they're saying that they have several behaviors that they're trying to change, then they need to decide on one. Which of the behaviors identified is the most concern? How often does it occur? What is the duration? When does it occur? So these are some things that you can look at when observing the behavior that you're trying to change. So looking at how often does the behavior occur? How long does it last? And when does it occur? The answers to these questions will help determine how and when to measure problem behavior. So let's talk about how the target behavior will be measured. So you will need to decide between a standardized measure or an individualized rating scale. So the individualized rating scales or self-rating or self-anchored scales, these are tailor-made for each client and measure how client operationalize target behavior. So the disadvantage of using this is that it's not reliable and they only have face value. Using a standardized measure is more reliable and valid, and you will have instructions on how to administer and how to score it. The disadvantage is that it may not reflect how the client has operationalized the target behavior. So you'll have to decide between these 2 scales and determine which one you will use for your single subjects design. They both have advantages and they both have disadvantages. So just choose the one that best applies to your situation. You need to decide on what characteristics or dimension of target behavior to measure. So, are you measuring the intensity, the frequency, the duration, the presence, and the absence? You need to ask, how often does the behavior occur? How long does it last? How intensive is the behavior? What implications do the chosen dimensions have for the goal of the intervention? Assess only one characteristic or dimension. So you need to decide which characteristic or dimension you want to assess or measure. You need to make sure that you're only assessing one. So, in case of the individualized rating scale, decide how many response categories will be used. Using too few will not allow one to document changes in target behavior, and using too many will make it difficult for clients to distinguish between the response categories. So the recommended range is to use 4 to 7 categories for that. After deciding on the response categories, decide on the rating scale anchors along with the client. So the anchors consist of behaviors, thoughts, and feelings the client experiences at each response category. Each anchor is associated with a response category. So who will measure the target behavior? Is it the client that's measuring the target behavior? Is it the social worker? So in your case of writing this paper, I'm pretty sure basically your partner is going to be the one observing and measuring the target behavior and reporting that back to you. So with client reactivity, the client may be a good choice as he or she knows when the behavior occurs, but this also raises concerns about reactivity, which refers to changes in target behavior due to the client recording the behavior, and this also causes a threat to internal validity. A parent or a teacher may be a good choice if the target behavior is measurable and depending on where the behavior occurs. The client's awareness that the behavior is being measured may make them change their behavior. So it's important that as the observer, that the observer observes the client without any distractions, without the client really noticing that they're being observed. As a general rule, data should be collected in a setting where the target behavior occurs or occurs on a regular basis. So the single subject, single case, single system case design, they have phases. Okay, so the first phase is the baseline phase. The baseline phase is where there are repeated measures of the dependent variable taken prior to implementing the intervention. It serves as the control condition, like when you have a control group in an experimental design. With the baseline phases, basically provides an opportunity for the researcher to conduct the assessment to determine the targets of change, to specify corresponding relevant measures for evaluating the change, to evaluate the severity or the frequency of the problem before implementing any specific intervention, and to establish rapport. Baseline measures help determine if an intervention is warranted. So when you observe your client for the first 4 weeks or the first 4 different times, you're basically observing that behavior to determine if an intervention is warranted. Measurements of the dependent variable should continue until a stable pattern of behavior is obtained. A stable pattern is a predictable pattern to the occurrence of the problem behavior. If data points are plotted chronologically on a graph, a stable baseline is indicated by a flat line across 3 to 5 data points. During the baseline phase, to infer causality, it is important that you have enough observations to demonstrate that the intervention caused the change in the target behavior and that not extraneous events. So basically, I know for this paper, you're asked to make sure that you have at least 4 observations before you introduce the intervention and then 4 observations after that. It's really important that you establish a pattern to make sure that you can see if there is a difference, right? If you only observe one time and then you gave the intervention and the intervention worked, you can't really say the intervention was what caused the change because you really didn't observe to see if there was even a pattern that warranted an intervention. So generally 5 to 10 observations are recommended during baseline. So in the real world, in real life, if you were out in practice in actually doing a single case design, you would want to have at least 5 to 10 observations during the baseline phase. An extraneous event is one that occurs during baseline, resulting in a change in target behavior that cannot be attributed to the intervention. So anything that happens during the baseline that has nothing to do with interventions. If a stable baseline is taking time and delaying the intervention is not an option, you should consider constructing a retrospective reconstructive baseline. And this is done from past data. So you would ask clients to recall specific events that occurred in the last 1 or 2 weeks. And you can also use data that's already been collected, that's already available. In some situations, one is unable to conduct a baseline because immediate intervention is required. So sometimes a client may be in crisis, or when a client is at risk of harming themselves or others. So those are times when you wouldn't be able to have a baseline phase. You would have to go straight into intervention. Sometimes you may need to conduct the baseline after the intervention, or to reinstate a baseline when the intervention appears to not be working. Before the intervention, review the literature to determine what intervention will be the most effective in treating the target behavior. In your paper, please make sure that's a part of your literature review. Your literature review is on the target behavior, but it's also on the actual intervention that's effective, especially the intervention that you plan on using in this case. So the intervention phase, or what we also call treatment, is the B phase. So this is where the clinician delivers the intervention aimed at changing the target behavior. This is implemented after obtaining a stable baseline to avoid erroneously attributing the difference in behavior to the intervention when actually the client's behavior was getting better already. Measurement of the target behavior is ongoing during the intervention phase, and the observations are compared to the baseline observations to determine if the intervention is effective. So there are 4 types of single case designs. We have a case study, the basic single case, the experimental single case, and the multiple baseline. Experimental designs are much debated due to the belief that if removing the intervention, which would result in a target behavior returning to its original state of occurrence, is unethical and not appropriate for social workers. Case studies or pre-designs are ones where the researcher only conducts observations of the target behavior during the baseline phase. They implement only the intervention without observations of the target behavior during the intervention phase, and they implement the intervention with observations of the target behavior during the intervention phase. So there are 3 types of case studies: the observation only, which is labeled A, the intervention only, which is labeled B, and the simultaneous intervention and observation, also labeled B. So with the observation or measurement only design A, it is one where there's only measurement of the target behavior but no intervention. So this type of design is useful for determining if an intervention is even warranted. So when the changes to the target behavior is attributed to extraneous factors, then this design does not allow for studying the effectiveness of an intervention. So with the intervention only design, this is one where there is implementation of an intervention, but there's no observation of the targeted behavior before or during the intervention phase. This design is appropriate when the client is at risk of harming themselves or others. So this design does not allow for studying the effectiveness of an intervention because there's no measurement of the target behavior before or during implementation. With the simultaneous intervention and observation design, this is where there is implementation of the intervention and observation of the target behavior during the intervention phase. So the design is appropriate when the client is in crisis and the researcher is interested in determining if the intervention is helping the client's distress. This design cannot be used to conclude causality as there is no pretest data. However, scores on outcome variables are compared with a cutoff score, which is used to indicate if the person's scores puts them in a certain category. Such designs help researchers explore if an intervention is having or is not having the intended effect. This design does not control for extraneous variables, so it has a weak internal validity. So internal validity is the ability to conclude that change in a dependent variable is definitely attributed to manipulation of the independent variable. So one threat to internal validity is history. So this is if some event occurred at the same time that the client received the intervention, so that resulted in the outcome. So it'd be hard to tell whether the event that occurred changed the target behavior rather than the intervention because they both occurred at the same time. So the threat of reactivity occurs because participants realize that they are being observed. So in this case, being observed make a difference in the outcome and not the observation. So if people know that they're being observed or studied, then they will act a different way. And so that will have an effect on the behavior. And if that's also occurring at the same time of the intervention, then you cannot tell if it's the intervention or the reactivity that's actually causing the target behavior to change. External validity is the ability to generalize the study's results beyond those persons included in the study. The design is affected by the following threats to external validity: interaction of selection and the intervention. So a characteristic of the participant caused them to respond differently to the intervention, or it can be interaction of history and the intervention. So an event occurs concurrently during the intervention that may not be present at other times. And then there's also the threat of reactivity. With the basic single case design, this is referred to as the AB design. It's the most popular design. It's an easy design to use. This design has both the baseline and the intervention phase with measurement of the target behavior in both phases. The intervention is not implemented until there is a stable baseline. It allows one to evaluate the effectiveness of the intervention by comparing the extent to which the target behavior was occurring during the baseline phase with the extent to which a target behavior is occurring during the intervention phase. This design allows one to infer causality if one can demonstrate that the intervention caused a change in a target behavior and not an extraneous variable. The threats to internal validity with this design is history threat, reactivity threat, and the statistical regression to the mean. So statistical regression to the mean is when the participants were selected for intervention based on extreme low or high scores on the pretest. So they tend to perform better on average on the post-test than they do on the pretest. Threats to external validity with this design: interaction of testing and the intervention. As a result of pretesting, participants may become sensitized to the treatment, interaction of selection and the intervention, and also interaction of history and intervention, and finally reactivity. The multiple baseline design has multiple bases across target behaviors, clients, or settings, and the intervention is staggered across these entities. So across target behaviors involves one client or client system with two or more target behaviors, which is a different baselines, that occur in one setting. Across settings involves one client or client system who has one target behavior that occurs in two or more settings or different baselines. Across client systems involves two or more clients who exhibit the same problems in the same setting. The design is useful when clients has more than one target behavior of concern. As soon as baseline is stable for one target behavior, the intervention begins while the baseline for another target behavior is continued. This design controls for the effects of extraneous variables by having more than one baseline. If some extraneous event coinciding with the intervention and improves target behavior, the improvement will show up in the graph of each target behavior at the same time, while baseline continues for target behavior not being intervened on. So it is recommended to have at least 3 targeted behaviors. The more baselines you have, the stronger the evidence you have to demonstrate causality. This design can be used to determine if the intervention is effective early, midway, or late in the process. This design has strong internal validity. It can be affected by statistical regression to the mean, which is a threat to this design if participants were selected to receive the intervention based on having extreme low or high scores. There are different types of designs that you can use within the single subjects, the single case, the single system designs. Most of the times people tend to use the AB design because that's the simplest design, the easiest design, but that's not the best way to select which design to use for your paper. Basically, it will depend on the target behavior and the intervention that you're implementing, and that's how you'll decide which design is a better fit for that situation. So the most common method of analyzing data is visual inspection or eyeballing of graph data to determine a pattern. Data are graphed on a line graph with the time period on the x-axis and the measurement of the target behavior on the y-axis. There are 5 aspects that should be examined. The level, which is the magnitude of change in level between the baseline and immediately after intervention period. Large change indicates that the intervention is responsible. Stability, so a clear, predictable pattern from baseline to intervention phase and within the baseline and the intervention phases. Trend data, pattern in data that indicates that the target behavior is improving, so there's an upward slope, or it's deteriorating, a downward slope, or it's staying the same, which is the flat line. The slope is the magnitude or the steepness of the trend. The overlap is the extent to which the pattern in the data across phases overlap with each other. Less overlap means stronger evidence that change resulted from the intervention. Visual analysis may increase type 1 error. Results may appear to indicate that the intervention was effective, but this was due to how the data was graphed. For example, if intervals between data points are not the same. Software used to graph data from single case design evaluations include GraphPad, Prism, Microsoft Excel. So in this class, we've always used Microsoft Excel to graph the results for this paper. Statistical analysis is rarely used to analyze the data from single case designs. Most of the assumptions related to inferential statistics are not met. So you don't really have inferential statistics when you use single subjects or single case designs. Additionally, there is no consensus about what statistical approach to use to analyze such data. So here's a graph of what your AB design would look like if you used an AB design. In your paper, you need to make sure that you do include your graph. So you do have to graph your results, and it would look something like this if it's an AB design. If it's a different design, it'll look different, but it'll still have these major things. So we also need to consider ethics and diversity when using the single case design. It's unethical to remove an intervention, especially if a client is responding to it. So experimental single case designs are not recommended for evaluating clinical practice. Basic single case design or multiple baseline design is recommended instead of using the experimental single case design. With any type of evaluation, it is important to get the consent of the participants. It's important to discuss policies and procedures of obtaining consent. On the consent form, find out if the consent form for provision of services also covers the consent engaging in research projects or the evaluation of your work with the client. If not, develop a consent form for this purpose. The consent form should describe, at minimum, the purpose of the evaluation, how many sessions, the benefits and risks associated with the intervention, how confidentiality will be maintained, and what happens if the client does not want you to evaluate the intervention you propose to use. You need to find out if your agency has an IRB or another entity that reviews requests for research or evaluation projects. If you're at a university, the universities have an established IRB. If you're working in an agency, you will need to determine if they have one at the agency or which one they do use, because you cannot conduct any type of research study without using the IRB or getting IRB approval. The role of diversity needs to be considered when deciding to measure the target behavior. With the diverse groups, individualized rating scales may be more appropriate than standardized measures, which may lack conceptual equivalence, which is the extent to which concepts represented by the items are understood to have the same meaning across cultural groups. Some standardized measures may be appropriate to use with diverse clients because they are reliable and valid for use with certain populations. For example, the use of Chinese version of the depression scale to determine effectiveness of cognitive behavioral therapy in reducing postpartum depression in Chinese women. So it's really important that you know or you determine what measurements you want to use. If you want to use the individualized rating scales or if it's more appropriate to use a standardized scale, because you really do need to consider using these scales with diverse groups and making sure that they're appropriate to use with those groups. All right, so I think this brings us to the end of chapter 15.